Oftentimes, people believe that OCD is only about repeatedly washing hands or perfectly arranging things, but in reality, it can manifest in many different forms. OCD is a mental health condition where a person experiences recurring, unwanted thoughts, obsessions, that compel them to perform repetitive behaviors, compulsions. These compulsions can interfere with daily life and social interactions. OCD can also take the form of sudden, intrusive thoughts, such as fearing that you might crash into another vehicle while driving. While everyone experiences obsessive thoughts or checks things twice at times, in OCD, these behaviors reach an extreme level. It can consume hours of a person's day and make daily activities challenging. OCD is typically chronic, meaning it can last a lifetime, with symptoms that may worsen or improve over time. Now, you might be wondering, how do you recognize OCD? Because it can present itself in so many ways. OCD symptoms are broadly divided into two main categories: 1, obsessions, and 2, compulsions. Obsessions often involve an intense fear of contamination or germs, fear of harming someone, an excessive need for perfection, overwhelming religious concerns, superstitions, and persistent doubts about relationships or one's partner. On the other hand, compulsions include excessive cleaning and frequent hand washing, repeatedly checking things, arranging items in a specific order, following strict routines for safety, constantly seeking reassurance by asking, "Am I okay?" or repeatedly having someone else check their work. OCD symptoms vary widely, and explaining each one in detail would take an entire video. That's why we will cover OCD symptoms thoroughly in a separate video. There's no need to panic because OCD treatment is available. With the right approach and timely intervention, OCD can be effectively managed and even completely treated. Now, let's explore the treatment options for OCD. OCD treatment is divided into two categories: natural methods and clinically tested methods. Let's understand when and how to choose the right treatment. First, natural method. To manage OCD, maintaining both mental and physical health is crucial. Mindfulness and relaxation techniques, practice deep breathing, body scan meditation, and yoga to reduce stress. Identify and challenge negative thoughts. If a thought keeps repeating, ask yourself, is this really necessary? Cognitive restructuring helps reframe your thinking pattern. Exposure and response prevention therapy. Start with small exposures and train your mind to resist compulsions. Physical activity and healthy lifestyle. Engage in brisk walking, cycling, or light exercise daily, and follow a nutritious diet to keep the brain and body in balance. Journaling and write strategies, writing down thoughts and tracking patterns can help gain control over OCD symptoms and improve overall mental health. By consistently following these habits, OCD symptoms can gradually decrease. Second, clinically tested method. However, when natural remedies do not provide sufficient relief and OCD symptoms persist, clinical treatments become necessary. There are several treatments, like cognitive behavioral therapy and exposure and response prevention therapy, but repetitive transcranial magnetic stimulation is considered one of the most effective options. rTMS is a highly effective and safe treatment that helps in managing OCD when other methods do not work. Let's dive deeper into how rTMS works and why it is a promising treatment for OCD. rTMS is an advanced non-invasive treatment that works without surgery or pain. It uses magnetic pulses to activate specific areas of the brain that are affected by OCD. This treatment is highly beneficial for individuals who do not respond well to therapy or medications, or those experiencing side effects from medications. Studies show that a few weeks of rTMS sessions can significantly reduce OCD symptoms. One of the biggest advantages of rTMS is that it has fewer side effects compared to other mental health treatments, making it a safe and effective option. rTMS is a scientifically proven brain stimulation technique for treating OCD. Various studies confirm its effectiveness, though results can vary from person to person. For example, A study found that 46.2% of patients experienced at least a 30% reduction in OCD symptoms after rTMS treatment. The Yale-Brown Obsessive-Compulsive Scale was used in this study to measure the severity of OCD symptoms. rTMS primarily targets dorsolateral prefrontal cortex and supplementary motor area to regulate brain activity and reduce OCD symptoms. In 2018, the FDA approved rTMS for the treatment of OCD. When it comes to the standard FDA-approved protocol, a typical rTMS treatment course involves 5 sessions per week and generally continues for 6 weeks, 30 sessions. Each session usually lasts 18 to 30 minutes, depending on the device and the specific protocol used by the clinician. However, this is just an estimate. The exact number of sessions and duration is determined by the clinician based on the patient's response and specific needs. Some patients may see noticeable improvement within 4 to 6 weeks and 20 to 30 sessions, but this can vary for each individual. OCD is not just a habit, it's a mental loop that traps you in repetitive and distressing thoughts. But with the right treatment, whether it's natural methods, CBT, or rTMS, you can regain control. Remember, you are stronger than your thoughts. If you found this video helpful, don't forget to like, share, and subscribe. Your one share could change someone's life. Drop your thoughts or experiences in the comments below. See you in the next video. Stay strong, stay aware.